Hi, it's Dr. Centeno, and I had given this as part of a Facebook Live, but apparently there were some problems with the slides changing, so I promised everyone I would re-record it. The title here today is Can You Be Killed or Injured by a Bad Upper Cervical Injection? This is not a topic I particularly love talking about, but it's an important one to bring up. So I want you to like, comment, share, subscribe because that's how we get this out to more patients like you. And realize that I've got a new site for questions on the PICL and CCI and me providing written answers. So this is Q&A with Dr. Centeno on Reddit. And then there's a great Facebook group that's run by patients where I don't participate on purpose because I want patients to be able to talk to patients without me jumping in at all. And the people that run this group are very responsible, and I think you'll get great answers there as well. So, patients often incorrectly believe that medical procedures are a lot like consumer goods, right? I've talked before about PRP at Clinic A does not equal PRP at Clinic B, even though they're both called PRP. So, for example, they might be very different in concentration, very different in makeup. Obviously, there are huge differences in the doctors doing the procedures and their level of expertise and where they can get that PRP versus not. Now, that's just basically bad for your wallet. But now we're talking about something that's bad for your health here today. And that is an upper cervical injection at Clinic A does not equal an upper cervical injection at Clinic B. And we're going to talk about that because I think patients often believe, hey, I can buy a bottle of Clorox at Target. It's going to be a little more expensive than if I buy it at Walmart. So here's the dangerous post that started today's discussion. And I'm not going to mention the doctor that was talked about here. I'm not even going to mention the poster because I don't want to throw anyone in the bus. But I do want to teach you, as the viewer, how to avoid getting hurt out there. So this was a post on some social media thread that said, Dr. So-and-so has installed new equipment, and he says that they'll do upper cervical injection, potentially the PICL as well. And then it says edit, no, they're not going to do the PICL. And then there's a disclaimer, no, I'm not a doctor, I can't recommend or endorse anybody. But that's what's happening here. There is some endorsement here. And so it says there's this new place and it gives the state, it gives a web address. Here's what I know so far. Dr. So-and-so is a neurosurgeon with a master's in whatever. He now runs a regenerative medicine clinic in whatever state. Here's his YouTube. And the last time I talked to them in November, they were using ultrasound guidance and had this imaging machine that they couldn't fit through the door. But now they've been able to fit it through the door and they're now starting to offer upper cervical injections. And then it gives a picture of this massive imaging machine. And it looks super duper cool. As you'll see, there's just one problem with all of this. So the first impression that I had as an expert in this space after looking at this post is this is the blind leading the blind over a very dangerous cliff where someone's going to get hurt. So let me get into that. So here are the questions that these patients, the one that posted this and the people that were commenting should have asked. Why is a neurosurgeon doing spinal injections? They don't get spinal injection training. So that means that this guy would have to go back basically to school to learn how to do this. That brings up question number 2. Is this guy even a neurosurgeon? Why is a machine designed to place spinal hardware, which is what that machine is designed for, being used for upper cervical injection, something it wasn't designed to do? Has this guy ever been trained in upper cervical injections? And does this machine have DSA or the feature that prevents you from stroking out a patient when you're injecting the upper neck? So let's get into all of that. So some background, what is an upper cervical injection? Why is it a big deal? How can a bad upper cervical injection kill you? So there are levels of upper cervical injections. There's what I call simple and dangerous, and you could teach someone to do that in hours. You stick a needle in the upper cervical spine, and when you hit bone, you inject. Problem is, it's a super dangerous thing to do, but there are doctors out there doing it. Then you get into simple and less dangerous. They use some ultrasound, but you still can't tell if you get into the vertebral artery, and if you inject in that vertebral artery, you're going to stroke out the patient. And you could learn this, let's say, in a weekend course. And then there's complex, which is what's really being talked about here. You don't use a machine like that unless you think you're going to use fluoroscopy to place a needle in the C0 through C2 facet joints, and then confirm that placement with contrast, and then trying to make sure you're not in the vertebral artery, you need to use something called DSA. So these are the hypercervical facet joints, and we'll be talking a lot today about the C0, C1. That's the one between the skull and the atlas or upper neck. And I've, just to go through this here, these yellow circles are just where the 0, 1 and the 1, 2 entry points would be. But you see that for the 0, 1 in particular, this vertebral artery runs right past that joint, and that vertebral artery goes up to the brain. So if you inadvertently inject into that vertebral artery, you're going to stroke the patient out, which is why this injection is a really big deal. So this is a 2023 case, I believe, might be 2022. I'm forgetting the exact date, but I got depoted on this case, or I was going to be depoted on this case. They settled it. So I talked to the attorney that was defending the case. I got all the records. I reviewed all the records to see what happened. And I was involved only because I had seen the patient and safely done a 0-1 injection in her before. And then I had told mom and this young woman, she's a college age female, not to get a 0-1 facet injection outside of Colorado because of these risks we're going to talk about today. Well, they did it anyway. She was an HEDS patient with CCI. The physician who did this injection, who was in the Northeast, was a very experienced spine physician, but he had never been proctored on injecting 0-1. So he had kind of just picked it up on his own. He got confused by the very complex anatomy in this area, and he ended up placing the needle into this woman's brainstem and then injecting, obviously causing quite a bit more disability. So this stuff really happens. So we went over those questions. So let's go after these first two, right? And this gets down to, is this guy a neurosurgeon? Because something doesn't smell right here. And anyone, either the poster or the commenters, could have figured this out in just a few minutes on Google. So neurosurgery is a 7-year residency after medical school. Anesthesia is a 4-year residency after medical school. So here he goes to the university, whatever, School of Medicine here. And then he goes from there to this place for a surgery internship. That all makes sense. Then he ends up going and starting a neurosurgery residency, but he's only there for 6 months. And then he goes into an anesthesia residency, but again, he's only there for about a year. So he never completed the neurosurgery residency, and he didn't complete the anesthesia residency. So I confirmed all of this by doing an American Board of Medical Specialties board certification lookup. And guess what? Just as I expected, he has no board certification in anything that is recognized by the American Board of Medical Specialties. So this is a guy with some residency training, just a little bit, who dropped out, got kicked out. We don't know, but we do know that he never got any of the major board certifications at all. So that first part is a total fiction. He's not a neurosurgeon, and it took about 2 or 3 minutes to figure that out. So let's get into these other ones. So why is a machine designed to place spinal hardware being used for upper cervical injections? Well, anyone could have Googled this machine and seen that the only thing that's talked about on the website advertising this very fancy big old machine is it talks about its use for spinal hardware. It is not designed for spinal injections. It is a fluoroscopy unit of a sort, so you might be able to use it for spinal injections, but it's not optimized for that in any way. So again, we now have something again that could have been Googled here that is starting to look pretty shaky, right? We have a guy who someone claims is a neurosurgeon, is not a neurosurgeon, doesn't have any board certifications at all, is using a machine that's not designed for spinal injections, presumably to inject the highest risk joint in the entire body, which is C0, C1. So already all of this is not sounding good. Then we get in, has this guy ever been trained in upper cervical injection? So let's talk a little bit about that. So upper cervical facet training. The first thing is you need to have an ABMS board certification to gain entry into a legit post-grad upper cervical injection course. He has no ABMS board certification, so he's not going to get into one of those courses. And then even if he could get trained, if he found someone that was willing to train him, you need to have extensive proctoring. Now that's going to be problematic because certainly we could train this guy how to do 0-1. We have enough volume to do that. But I wouldn't train anyone who has no board certification. And the big reason is if something happens during that procedure while he's doing it and I'm right behind him, that's an unacceptable malpractice risk. Because the questions would be, well, why'd you let this guy do this? This guy didn't finish any residency program at all and has no board certifications that are recognized by the ABMS. So what is proctoring? That's where an experienced physician stands behind the physician learning the procedure. The standard for complex higher risk spinal injections is 20 proctored cases. And the problem is getting 20 proctored cases is going to be impossible. There isn't a clinic outside of our clinic in Colorado that does enough of these injections with enough frequency to allow him to fly out for a week or something and get 20 cases. This would be a multi-year process because these 0-1 injections are done so infrequently at the few clinics that offer them that it would be a nightmare trying to get trained. And like I said, probably not going to find someone to train him anyway. So then the final question is, does this machine have DSA or digital subtraction angiography? And that's the feature of a C-arm that prevents you from stroking the patient out during a 0-1 injection. It allows you to highlight just the artery to see if you were inadvertently injecting into the artery. Because if you inadvertently inject into this artery, there's a good bet that you're going to stroke the patient out. So that machine doesn't have DSA, which makes sense. It's not optimized for spinal injections or any type of interventional procedure that isn't putting hardware in the spine. So we have here that this guy's not a neurosurgeon. In my humble opinion, this all is not safe. But it still made it onto social media. And had I not spoken out, and I will give the original posters some credit that they did take it down once I spoke out, this would have been a very dangerous post. And if I know about one dangerous post, there's 20 or 30 or 40 dangerous posts out there that I know nothing about. So be very, very, very careful. So in summary, based on my experience as an expert in this area, there are very few places capable of performing safe upper cervical injections. So be very careful there. 5 minutes of Google time could have allowed these patients to find lots of red flags here that just didn't sound right with regard to this specific claim. And please don't trust the recommendations you find on random internet threads on CCI. So again, like, comment, share, and subscribe because that's how we get this out to more patients like you. If you want to pay it forward to other patients, then do these things. Thanks so much for watching and have a great day. I don't enjoy making videos like this, but they are necessary to keep the CCI community safe. So thanks for taking the time to consider all this information.